Thank you very much. I probably don't actually represent the university sector. As they said, they're very big, hairy gorillas, and I would never seek to represent their views in anything. I'm just going to try and transmit some of the things that I've heard my colleagues say to you, hopefully faithfully. So it's been really a great opportunity to follow Steve and Tony, because they've really covered many of the points that I think the university sector also share around our aspirations and hopes for the Medical Research Future Fund. And also they've reiterated some of the long-standing discussions we've had about moaning about the loss of the clinician scientist. That has been going on for decades and decades, and I hope maybe this is a chance that we'll see those rare species reborn, but maybe not. But I think a lot of the things we've heard in the last two speakers' talks, I'm not going to go through because I was pretty much confident that they would say most of those things. So I wanted to just start with this slide. I'll just let you read it. Because there is always an element of skepticism when you see large pools of money coming forward from government, because obviously they don't have a money tree, and where money is put into one new sector and the seagulls, as we've heard, start fighting over the chips, we know that there's a loss of money somewhere else in the sector, and maybe that money was not put to good use elsewhere, and so it's rightfully consolidated into a new pot of money, and it leads to new initiatives and new outcomes. But sometimes there's a loss in the sector that can't be replaced, and in fact is served to ultimately undermine the ultimate purpose of what we all seek to achieve. So I think that's something just to bear in mind when new announceables come on the scene. This is really what the research, what the universities are set up to do, and I just wanted to remind you of those things, because that is something that all the universities sign up to as higher education providers. They're required to do research, so research is part of their requirement to be recognised as a university in this country. They need to be comprehensive in terms of the courses they provide to students, and that means they need to cover a minimum of 3 broad fields of study. And in fact, 25% of the universities in our country cover all 10 major fields of study, which means that they're providing courses and training to a vast workforce of people who are ultimately going to be the people that are needed to execute the aspirations of the MRFF, particularly in the health sector. And universities in the G08 sector have roughly 50,000 students, so there's a lot of people being trained who are going to be needed in delivering on the aspirations of MRFF and other sources of funding. They self-accredit courses, which what that means is essentially they design their programs and courses and develop a program of accreditation internally. And although that's overseen by TEXA, ultimately they have a lot of autonomy in terms of how they design and implement the courses of training, and so there's another point of interaction with the health sector and others. Academic freedom, everyone's heard about academic freedom, and anyone who's spent their life trying to manage academics will know what a very difficult task that is. So academic freedom and dealing with academics and getting them to move in a direction that you might like them to go is almost a contradiction in terms. Academics aren't told what to do. They have a self-governing, this is another component of academic freedom, they self-govern their communities of practice. So that's an important something to recognise as you seek to interact with universities. And finally, they have a broad social responsibility, which I think lines perfectly with the MRFF fund, and the importance of the social responsibility is a really sweet spot for universities, and I think that's something that drives the motivation of universities and is a shared value between what universities seek to achieve and much of what we've heard about this morning. Now, as I said, I can't possibly represent all universities' views. There are 40 full universities in this country, and they do seek to try and conglomerate themselves into those 5 different types of universities, and they share some things and they don't share a lot of other things, other views on other things. But by and large, as I said, they all sign up to those principles that I put forward on those earlier slides. So I just wanted to reiterate in a nutshell what the university sector think they've heard about the MRFF, and we've heard a little bit about it this morning from Ian. We've heard there's no duplication of the NH and MRC's role, so in the fund that supports NH and MRC and those programs will stay intact. We've heard, importantly, that there's no long-term funding coming out of MRFF, so this will need to deliver initiatives that are ultimately self-sustaining, either that they can exist within universities, exist within the health sector, but this isn't a business as usual fund. This is a fund that actually comes in, does something, but it needs to go somewhere and live somewhere. So if we produce outcomes from the MRFF that don't have a home that can be ultimately picked up and sustained long term, they will not be. So I think that's an important message as we seek to position ourselves to really make the most of this fund. There's a focus on the partnerships between our different states and also with industries. There's no particular flavour of disease. This isn't a fund to cure someone's favourite disease. This is actually on a much bigger scale than this. And we've heard from Ian in the first talk that the preference early is for these shovel-ready projects. I always hate the term shovel-ready projects because it always reminds me of pink bats, but I'm sure that's not going to happen here. Okay. So, what do universities expect? Well, we've heard much of this in the preceding talks, and I'm not going to belabour the point. We expect it to tackle big problems and follow through with delivery so that we have a way in which this can be sustainable long term. We would hope that it would facilitate the entry of new or repurposed technologies and discoveries into healthcare, provided that those health outcomes are improved as a result of those new technologies, and it's not technology for technology's sake. Re-engagement of the health practitioner workforce in research by whatever means, is whether that means a new generation of clinician scientists or that happens in a way that is quite different to what we've ever envisaged before. Open for all of those discussions. Data, that long, bad topic we talk about all the time, how are we going to solve the data problems, acquisition, management, sharing, all of those things, digitisation. Is this going to be the way that's the means to the solution to those problems? Using the power of a distributed university network, and by that I mean universities are 40 universities scattered over the country, and there will be no net gain to the country if all the investment happens in one tiny sector or one geographic part of the country. It really needs to be wholesale system change, which means you need touch points across the entire sector and across the entire country. We would hope that the funding would be merit-based, not advocacy-driven, and as we've heard from Tony's talk, transparency on the outcomes of what this investment delivers, good or bad. And my final point, and this is where I'm going to conclude, is I just wanted to mention something that I hadn't heard previously, is the importance of coordinating all these large Commonwealth investments that are going on at the moment. So we have Alan Finkel, who is working at the moment on the National Research Infrastructure Roadmap, and there's a lot of people sitting in the audience who would have been involved in the consultations here. And there's lots in that infrastructure roadmap that talk about the health and medical sciences, about data and imaging, and all the things that MRFF is also talking about, and how we connect those things up, international collaborations. We also have Alex Zelwinski, who's our Chief Defence Minister, a Chief Defence Scientist, talking about the fund that he has and has released the Defence White Paper and the large amounts of money that are going in there around technology funds, autonomous systems, a whole raft of other things that do have implications and translatability for healthcare. So really, how are those things being connected up, and are we going to reinvent wheels on different sides of these agendas? So are there three people that are pretty critical to this? I've said one is Alex Owinski, the Chief Defence Scientist, Alan Finkel, the Chief Scientist, and I didn't put Ian's name underneath there because we all know who he is. So we've got these three people who need to really connect up at one level, and then the connections underneath also need to be happening. So I thought I'd do a little test and see if I could find a photo on Google where they're all together, just to give me some hope that they were talking. Unfortunately, I found a photo of Alan of Ian with Alex, and Ian with Alan in the bottom right-hand corner. I couldn't find one with all three of them, and I couldn't find one with Alan and Alex. So after this, I'm going to go and see if I can find them and take a photo of them all together, so I can feel much happier about the way these guys are connecting up. So with that, I wanted to conclude and just reinforce again my support for what has been said earlier today. So thank you.